time for Medical Moments with Covenant Healthcare. Today we're talking about the resources and new technology for breast surgery patients. Today we're here with Surgical Oncology Coordinator Jen Kukla. So thank you so much for being with us today.
Thank you for having me. Good morning.
Good morning. All right, so you work in the Cancer Care Center and the Breast Health Center. Can you tell us more about those?
Sure. Our cancer center is the best in the region, in part because Covenant Healthcare is at the forefront of leading technology that benefits our patient population and assists our team. For example, the 3D mammography that we've had in place for the last few years assists our radiologists at the Breast Health Center to detect breast cancer at a very early stage and also benign lesions that could increase a patient's risk for breast cancer. With these tumors, they are very small and unable to be seen or felt from the outside of the breast. So our breast surgeons need something at the time of surgery to assist them in localizing these tumors for easy removal. There has been new development in this arena, so our team of breast surgeons and radiologists have worked together to implement a new technology called the localizer.
All right, so explain to us a little bit what that is. What is the localizer and what does that mean for people who are having breast surgery?
In the past, the only option for these surgical patients was what was called needle localization. And what that is a thin wire with a barbed end that's placed directly from outside of the breast to that biopsy clip that's left behind at the time of biopsy. This was effective in localizing the tumors, but it also had its drawbacks, some of which this wire could become dislodged or moved from the patient. The patients could only have this done the morning of surgery, so they had to arrive several hours prior to their surgery time, which increased anxiety for the patients and the family. Some of our patients with comorbidities or health issues that didn't allow them to have surgery at our on-site surgery center had to travel from the Breast Health Center after this wire was placed to the main hospital, which posed its own issues. Also, surgery times were delayed. And our surgeons had fewer options on where they could place these incisions depending on where the radiologist placed the wires. And the localizer has changed all of that. What the localizer is an RFID, or radio frequency identification tag, which is a miniature tag that is placed similar to the way a biopsy is done, with a small needle that's put into the breast tissue, releases the tag directly at the site of the tumor. This can be done for patients days, weeks, months even prior to our surgery time, which allows our patients less time on the days of surgery. It can't become dislodged or migrate. Our patients' anxiety, family's anxiety is reduced because of the amount of time spent at the surgery center has been reduced. Our surgeons are able to start earlier. Our patients can go to one location for their surgery as opposed to multiple ones on the day of surgery. It also allows our surgeons more options on where to place these incisions for a better cosmetic outcome for the patients as well. Because in the operating room, after this tag is placed, they use a handheld monitor with a small probe that is placed on the outside of the breast, and it picks up that radio frequency that's emitted from the tag to locate it. And it kind of gives a 3D picture so they can choose different areas to make the incision.
Sounds like it's a really good choice for the patients then.
It is.
Very interesting. Well, thank you so much for being here with us today and letting us know what's new and what's really beneficial for the patients. We appreciate it. And if you would like any additional information on today's topic, head on over to the hot link section on WNEM.com.